Ashley Neuter, and I'm here to have Bear neutered.
Hi, have you been a patient with us before?
No, I'm actually new here.
No, okay. Just need you to sign this patient-client information sheet and consent to perform the sedation for the surgery.
Okay.
If you mind signing that.
Finished filling out all the paperwork.
Perfect. When was the last time he consumed something?
About 12 hours ago.
Okay, and went to the bathroom?
An hour ago.
An hour ago? Okay, perfect. Why don't you have a seat and I'm gonna just double check a couple things.
Okay, thank you.
Hi, I'm Mackenzie. I'm here to take you into the exam room.
Hi, okay, we're ready to go back.
Okay, if you want to follow me.
Hi, good morning. I'm Dr. Brubaker.
Nice to meet you.
Hi, I'm here to examine Bear and do his surgery.
Okay, sounds good.
Okay, so I'm just gonna check his abdomen and the rest of his body first for any abnormal lumps and stuff like that first. Let's check his stomach, legs, arms. Okay, everything feels good. Just gonna check his heart rate. Okay, his heart rate's good. I'm gonna just listen. Okay, sounds good. Respiration is good. I'm gonna check his mouth. See all pink, that's good. No dental issues?
No, none.
Perfect. So look in his ears to check everything's okay and there's no wax buildup or infection. Look in his eyes. Perfect. And we're just gonna do temperature if you find adjusting. Okay, perfect. Okay, we're just gonna do some blood work in the back and we'll start the surgery. And we'll give you a call when everything's done.
Okay,
Okay.
thank you so much.
No problem. As part of the physical, we're just gonna weigh the dog. Perfect. Hi, Ashley. I'm just calling to let you know that your dog's blood work came back all normal and we're just gonna go ahead with the surgery right now for you. Okay? And we'll call you when the surgery's done. Thank you. Bye.
First of all, I'm going to place the IV inside of the patient. There we go. We're going to get the sedation process going. The patient should be fully sedated now. I'm going to double check by checking the eyes. Make sure all the limbs are going limp. Perfect. The patient is definitely fully sedated, and after the patient is fully sedated, we're going to shave the area. We're going to use a 40 blade, and we're going to fully shave everything around it. And after that, we're going to use the vacuum the area. And just to double check, we're going to vacuum it all over again to make sure everything's gone. After that, we're going to clean and disinfect. We're going to use a chlorhexidine soap and wipe the area. After that, we're going to use some alcohol. as well as iodine solution. Perfect, the patient is ready. So next we're going to place the endotracheal tube in. We're going to tilt the head back. I'm just going to move the tongue out of the way and then place the tube inside.
We are prepping for the surgery, so we are gonna put our gowns on and gloves on. We are taking the sterile gloves out of the pack so we can put them on. These are the instruments we use in a neuter. Olsen-Heger needle holder, scalpel handle, Mayo scissors, Addison forceps, Kelly hemostat forceps, Backhaus towel forceps, Rochester Carmel, mosquito forceps, scalpel, and gauze.
While the surgery is happening, I'm just taking note of all the vitals as well as the anesthesia gas. So now we're just going to remove the endotracheal tube. We're going to do it carefully and slowly to make sure no damage occurs.
And then we're gonna move the patient to recovery and check on its vitals and making sure he's recovering well before we can send him off home.
After resting in recovery, we're just going to take out the IV fluids. Patient seems to be recovering smoothly, so we're going to get ready to send the patient home.
So here's Sarah. Everything went well. He's healthy. It was successful. Everything seems good. So I'll just go get the surgeon to come out and just tell you like at home care and everything. So
Okay.
there's
Perfect.
Bear.
Thank you.
Healthy.
Prepping how much of the dosage medication the patient will need under surgery based on his current weight. Hi Ashley.
Hi.
Hi, so the surgery went well. I'm sure you know. We did put an e-collar on your dog. The e-collar should stay on for a while just to make sure everything's healing and the dog's not licking the wound, because then we can get infections. So you're just gonna wanna keep an eye every day, make sure it's still healing, it's not infected. If it gets infected, come back or give us a call, because we'll need to clean that up for you. And just wanted to provide you with some pain meds and some anti-inflammatory medications. The directions are on the label, as you can see. You just take it twice a day, and it's probably best with food. And if you have any other questions, just give us a call back.
Okay, thank you so
Okay.
much.
Yeah, no problem.